cases of COVID-19 on Guam now stands at 82. 12 patients have recovered, and there are 3 deaths.
Okay, so let's run to the phones here, 637-0094, and get Mary Rhodes from the Guam Hotel and Restaurant Association. Good morning, Mary.
Hi, Mary.
Hi, good morning.
I guess just first of all, let's start with the sailors being quarantined. What's the status on that, and what are you able to tell us about it?
The last several days, we've been focusing on really just coming to the terms of the agreement with the USS Roosevelt, similar to how we participated in getting rooms for our local quarantine facilities. It just happened to be at the same time where several hotels, we had 7 hotels go offline, where they suspended services April 1. So the timing of this is actually extremely important, because I don't think we could have probably participated with providing as much assistance with USS Roosevelt, except for the sheer timing of several hotels decided to suspend services due to the lack of tourist arrivals coming into Guam and the suspension of service from the airlines. So during a time of when things were starting to slow down for us, and understanding the need to mitigate all risks and really protect some of the businesses by closing their doors, a situation, of course, had risen unexpectedly with the USS Roosevelt, and we've been negotiating with them the last several days. A lot of the meetings that have taken place over the last 3 days is the cooperation of the U.S. Department of Defense, Joint Region Marianas, USS Roosevelt, and also we have been working with the government of Guam, especially with the Department of Public Health Social Services and the CDC, who's on island, for guidance, but also working with Guam Fire Department, Guam Army National Guard, and the Guam Police Department, and giving an opportunity for Guam to really look at the entire process from beginning to end, so that we could all learn from each other on what we can do when we're managing our local quarantine facilities, or possibly looking at this surge since the community outbreak is at the level that it's at. So there's a lot of moving parts, and I think that the USS Roosevelt is an anomaly. Outside of the numbers that will be presented today, we have to keep that very clear, that everything that will be shared today is really what's happening on our island. It has nothing to do with the USS Roosevelt.
Right, yeah. So, I mean, on the Roosevelt, they just had a press briefing, and the acting secretary of the Navy, Tom Motley, mentioned there are 114 infected now, and there's a quote here: "I can tell you there will probably be hundreds more." So that's where we're at with that.
Yeah, when you look at the percentages of how many they're tested and how many are popping positive, I think it's realistic for them to set expectations based on those numbers.
Right.
And so we've been given the directive of at least planning for 3,000 to 3,500. I know the initial report was 4,000, but our initiative is really based on 3,000 to 3,500. With the hotels going offline and inventory becoming readily available, which, by the way, all of those hotels that went offline are all also contracted with the military. So we have 13 hotels. I think I've shared that with you, Chris, many times. We have 13 hotels already contracted with the military. So what we're doing is working under the same parameters of the federal contract. And so this is...
And Mary, just to interrupt, these are hotels under contract, meaning that we have deployments rotate in and out of Guam, and the military it keeps like a certain number of rooms for these airmen, the soldiers, sailors who are deployed to the island, right?
Yes, but also it's any Department of Defense contract. So it could be government, civilian workers, all of this. This is a little different because this is not just normal course of negotiations with the federal programs that are in play. This is obviously an emergency, and so this is a different funding source directly with the U.S. government and Department of Defense.
Mary, so just to be clear, so people know, it's not like Admiral Maloney went and took over the hotels. Is this in some ways a business arrangement for you guys?
Absolutely. It's totally separate from the class system, which is what the normal course of action is with Joint Region Marianas and Guam, with regards to those 13 hotels that are military-approved hotels for regular Department of Defense business.
Mary, let me
this
ask
is
you again.
negotiated separate.
Sorry, what assurances are we getting? We know that where we're at now is only sailors who test negative for COVID-19 are going to be allowed to quarantine in the hotels. Are we, checking IDs on that, or is there any kind of paperwork we're getting that shows that these they all tested negative, or are we just taking people's word for it?
This is an extremely rigorous and stringent process. I think it's important to note that anyone that is currently in a facility, whether they're military, local residents, tourists, or any long-term resident or a long-term traveler that is in a facility, we are not commingling anyone. The parameters set forth in this is we've actually worked with hotels who currently have in-house guests. There's a transition plan where we have sought the assistance of other hotels to transfer so that we can make rooms available. This has been a really big operation to get to our 3,500 number. We're at 36 actually. And so we've had to work with the cooperation of everybody to get the transfers going so everybody can participate on this.
Mm-hmm.
But to meet the concerns of what you were talking about, we gave specific guidelines on a lot of things, and they came back with a 6-page document of doing way more than what we asked. So
can you just clarify this 3,600 number? That is, they need 3,600 rooms for quarantine?
The expectation out of the 5,000 personnel on the ship, they can only move 1,000 really at a time.
Right.
Just for us, for measures, security measures on the ship and operational as well. But the goal was really 3,000 to 3,500, expecting maybe some of the percentages of what they think that they will get as positive versus negative cases.
Right.
So with that, 3,000 to 3,500 expecting to be negative cases would be taken off, and we have all the assurances they have the test results of that, but it's all by serial ID. We're not receiving anything with people's names or information
for HIPAA,
because
right?
of HIPAA, of course. So we are receiving everything by serial ID. They are controlling the roster of the room and the entire operations of the hotel except for back of the house. And so I'm just going to explain a couple of things that we did ask for and we are enforcing with the process, but we do have controlled access to the exclusivity of the tower. We are not commingling anybody to reduce risk of exposure. We're also ensuring that entire teams are being deployed out in addition to help support this. So they have pulled resources from within the fence of different military branches and agencies to even outside the fence with Guam Army National Guard. And so we have whole teams of 30 up to possibly even 50 teams per hotel that would be assigned. And that's for the minimum 24 hours daily. So that's not even relief teams. And so that would be the teams that would be assigned to provide different kinds of services during that time, from security, enforcement of perimeters to every floor monitoring, down to even delivery of the foods, linens, pre-staging of all the rooms, having a command center. We have a reception area and then a command center and a security section. So we have a lot of different areas that we've staffed for, and they've allocated targeted resources based on their specialties and also roles during this quarantine period.
That's 30 to 50 teams, local employees, or is that's military?
All military mixed in with some local support.
Local support meaning guard or?
Guard.
Okay.
Mary,
So
government of Guam employees will be involved.
Okay.
It will be Department of Defense. It's a military exercise, a Department of Defense operation, and so it is truly a military operation as well.
Mary, they're talking about it's a weird way to put it, the military brand of quarantine, and Admiral Minoni seemed to really talk up that there's a no contact, no touch, and that these sailors are going to be confined to their rooms.
Yes.
Is this something that you can verify?
Absolutely. What we're doing upon arrival is we've pre-staged all of the rooms with supplies, with a case of water, as well as all the, we have 4 sets of towels and linens in every room so that there's no need to provide any housekeeping services or any additional requests for amenities. So all the rooms are pre-staged and they are open. So upon entry, the doors are closed. They are not given even key cards. They are not to leave the room. If they were to leave the room, it's already notified through monitoring of the floor monitors with enforcement, and they are subject to penalties. There is, in addition to our restriction of movement, they have a well-documented 6-page ROM that is they are still subject to from the USS Roosevelt, and so there are a lot
What's ROM?
Restriction of movement.
Okay.
So the ROM in this case is to the room only. They will only be allowed to use the balcony for sun exposure, smoking, and vaping. They are not to leave the room.
No rioting in Tumon, in other words.
No leaving the room.
I got you.
All the facilities of the hotel are off limits. We won't even have employees in the public areas except for front desk in the back office with operator. We have to provide a 24-hour operator service, but that is only to field any internal calls when they want to dial outside. If they want to call like local support or their families, we have activated phone lines where it's a direct dial in, so they don't have to go through the front desk. We are minimizing all needs for through the hotel services. So the command center will have outside lines, direct outside lines, and we have a command center in different areas so that they are fully functional without relying on the hotel. But we are going to have daily assessments on the daily screens and reports of different activities that take place with the health screening and other things with supply management, any incidentals that might happen that's just through the course of operations in a hotel.
Right.
So all engineering controls have been placed where we have reserve rooms. If something happens in the room where a toilet is plugged up or something happens, the policy is to move them to a secured floor, to secured room as well. So we don't have even access the room for housekeeping or engineering until the full quarantine period is over. So it's under strict controls, and we have a lot of rules with this. We also have outsourced all laundry, linens, and towels, similar to our other quarantine facilities. They've also added personal laundry to be added on a rotation. That's also outsourced. Also biohazard materials removal and disposable as needed. These are all negative cases. And so the risk of possible risk of any of these turning positive, it may happen within the 14 days, but unlikely. But if it were to happen, there are also measures in place for that to immediately remove them from the premise and to get them the medical assistance they need inside the fence.
Mary, there was a lot of people with a lot of concerns about, exposure and what the rules of engagement for the quarantine were going to be. But from what you're saying and what you said, it seems like they are exceeding at least the type of quarantine the government of Guam's doing. And it kind of sounds like you guys have put a lot of safeguards in place. Would that be your message to those people who are talking about possible exposure? Because it seems like you guys have really planned this out just so many steps ahead.
Yeah, this is a military and a Department of Defense operation, but also with the cooperation of private sector. So there's a lot of things that we requested that they agreed with, and so these are things that even on the private sector side was initially requested with GovGuam, and I think that there's been a little bit of a learning curve, but definitely I want to say the government of Guam has we've kind of been throughout the process in the other quarantine facilities. I think that although we may not have the full support for enforcement at this level, I have to say that the other things really have improved as far as the type of exposure levels and also the process flows in the hotels. And that's why they're included in this process as well, so we can continue to learn and to assess and to make changes in the other quarantine facilities as we are looking at a surge in our local community transmission. So I think that these are all opportunities to learn and grow with each other, but certainly the ask was there from private sector to do certain things to minimize, not even reduce exposure, to mitigate risk and make it almost to no exposure. And so everything has been followed but added, as you've mentioned. And so down to even removing of all items from the room outside of the bed, the lamp. We are trying to reduce any contact surface that we have to desanitize later. It is a very minimal operation. This is not a R&R retreat for them, although probably coming off the ship, even though they're stuck to a room in quarantine, this still is, in a way, probably even mentally for them, a really good opportunity.
It's an upgrade. I mean, mentally, than a little sardine can.
It's a time to really reset for a lot of people. And so I think it really is a win-win-win for a lot of the people involved in this process. And so I have to say the quarantine level, yes, is at a different level. But certainly with respect to GovGuam and what they're doing, I think that they've done what is available to them based on the resources. And the more that I think we can learn from this and tie in more resources together to improve our processes, the better for everybody.
Okay, so just to clarify, you said 3,000 to 3,500. That's what you guys are preparing for in 7 hotels, right?
In 8 hotels as of this morning.
8 hotels.
And
are they all in
correct.
Tumon?
Yes.
All in
Yes,
Tumon.
right now. They are all in Tumon, and again, we have to have exclusive access to the towers for no commingling, and
Right.
all perimeters and entrance areas have been reviewed by both federal fire and military, as well as local fire and local GPD. So we are going to assure that all entrance exit areas are secured, and the perimeters will be enforced.
So how much, I guess, what is the number of hotel rooms we have on Guam?
Oh, in general, we have anywhere between 8,500 to 9,250 based on rooms under construction or operational for sale. So this is going to take up about 1/3 of our rooms. And so we obviously have more inventory available. The question is, can we get complete towers available all at one time? And so that's what the challenge has been, is working with hotels with 300 rooms or more and having them secure those towers where they've had to do a lot of transfers. So the mobilization on this started 2 days ago. And so we've been able to really act quickly and with very little, with very little time, but with the cooperation of everybody. And we are looking to secure more rooms just today so that we can get up to our goal of 3,600 up to 4,000.
Okay.
Now, we may not need all the rooms. And so I have them on a schedule. So we're looking at possibly 10 hotels total. And they are on a schedule because we're only moving 500 a day. If they can move 1,000 a day, that's great. But really, the goal is 500, no more than 400 to 500 a day, because it's 1,000 off the ship, but they still have to mass shelter, test, get the results, mobilize, transport. So there's a very, very big process in all of this.
So we've been talking.
The goal is 400 a day to 500.
So you've been talking about what's happening for quarantine. We just got from Mr. Modley, 114 infected. I'm not sure what the hospital bed capacity is at Naval Hospital Guam. So are there also discussions about converting hospitals into isolation facilities for the military?
Absolutely not. Everything will be staying inside the fence. They've already taken over buildings and have started addressing those concerns within their facilities.
What about government of Guam area? Are there any plans to retrofit any hotels for any type of increased in hospital facilities?
Right, we know there's one.
Yes.
Right.
I know that you guys asked me that last week, and I wasn't ready to really answer that. There weren't any discussions at that time, but I know that there are plans, and at this today there have been discussions And so there hasn't been put anything into motion, though, as far as really planning with regards to contracting negotiations. But there have always been discussions, just so you know, prior to even the first hotel going into a quarantine facility, to identify a location where medical staff, from nurses and doctors, to go to, whether it's GMH or skilled nursing facility. So I have to make that very clear. It's not only for FEMA and possibly Army Corps of Engineers or future medical staff to come. We have been talking about this since the beginning.
Mm-hmm. And you said
So-
discussions today. Were those discussions with the Army Corps of Engineers?
No, that's actually with the medical advisory group. I spoke to them late afternoon yesterday, and I know that there are plans. There have been plans,
Mm-hmm.
but I think that understanding how we've been able to mobilize for this, of course, they're interested in understanding, in really engaging us. But I think that those are very different kinds of needs
Mm-hmm.
and a lot more challenging. And so we are going to have to discuss this, and we're going to need to, of course, implement, if not the same, even more measures than what we're implementing now, because right now we're dealing with negative cases.
Yeah.
That's a whole completely different scenario when you're
Mhm.
talking about isolation
Mm-hmm.
and much more the medical personnel that's dealing with positive cases all day long. And so there's a whole lot more that has to be discussed, planned, and strategized when it comes to dealing with those kinds of levels of services. We're not in quarantine mode at that point. And
Yeah.
so I'm not sure if all of the hotels, I am sure all of the hotels would not participate in that. And that's why even we've been discussing, what would be that next level, whether it's even the Stafford Act or what would be required in order to get to that level. And I don't think that we've really had the time to really be in the war room to talk about those kinds of things. Right now, we're really addressing the mission critical situation with the USS Roosevelt, and we've put out our parameters, and they've exceeded those, and so we're in cooperation with them on that. And so we're trying to balance community risk with the mission, specific mission that they have with the military, and of course the private sector and the protection of our employees as well as our assets. People are our greatest asset, but we have facilities and other assets, especially soft goods that we within the rooms and the public infrastructure that has to be considered. So there's a lot that needs to be discussed when you talk about medical supplies, medical facilities, and mass shelter for medical personnel.
Mm-hmm. Okay, so just so the community is aware, we've got the quarantine facilities that are going to be negative sailors.
Negative cases only.
Right,
in
in the
case
hotels,
that they
and no
come-
discussions about isolation centers in the local hotels for the military. They are going to handle that inside
Absolutely
the
not.
fence. Yeah, I just wanted to make sure people are completely clear, in case
It
they
doesn't
start.
matter if people are completely
Well,
clear.
no, they
They're
need
still-
they
yeah,
need to.
they
I
need
mean,
to know
people
what,
are people,
what is
and I'll
going
give
on.
that.
Yeah.
I'll let you have that opportunity, Mary, to address people that are concerned and
I think
complaining.
whether or not they even communicated those, Sabrina and Chris, to be fair to everybody,
Mhm.
regardless, even if we had a 5-point message and put out a press release and said, and I think it has been stated in the past that this is negative cases only.
Right.
Mhm.
Yeah.
This is national news now,
Yeah.
and international news. Regardless, as many times as we can say and reassure everybody, it's still all negative cases.
Mm-hmm.
The concern is that there's more exposure, possible exposure
Right.
Yeah.
in time.
Yeah.
And also the concern is even negative cases have come out positively.
Right. So
Mhm.
and
So
again,
we have to manage all of that,
right.
and we have to be very realistic in how we're managing it. So that's why in putting all these parameters and security measures in place, we have to do more because you have to anticipate the worst case scenarios.
Mhm.
And so that's why I think it's been a really good the last 3 days, we've had the cooperation of the military and the government of Guam to really understand how we as private sector see this and would want it to be implemented, because it's a big decision to close the doors. And if the businesses weren't going to entertain other ideas with very little, with all the security measures in place, then it's very difficult to have those conversations and to explain that to our employees and to our owners that, this is the reason why we're doing it. There's humanitarian effort, and then there's just also the business aspect of it. So we have to balance all of that. And because they've come to the table and they've exceeded everything we've asked for, and they have their own strict protocols in how they administer and manage the engineering and controls on this, then, it really is a matter of cooperation and try to reduce the risk. And I've even asked GovGuam to have a small team to work with me as a command center. We don't necessarily need to do that, but I think it's important to include GovGuam in this so that we always understand on a daily basis how it's performing and what the issues are, what the challenges are, and how we addressed it. So this, again, is a learning opportunity for everybody. But at the same time, GovGuam is involved because we have the military buildup. And so I'm working closely with Vera Tapasnia on this. She is the GovGuam counterpart when it comes to anything with the military or Department of Defense. And so she's been really great. I'm working closely with her, GPD chief and the fire chief, as well as public health and CDC. So I kind of see that as our local command center group with private sector in ensuring that the military is doing what they're saying they do, and we also have a way to assess that.
Right.
What would be your response, though, to Mary, to people who would say, why can't you keep them, the sailors that tested negative,
People,
inside the
you mean
fence?
senators?
Inside
Sabina,
the
right?
fence, they have the resources, they have the land, they have the facilities. And I'm just asking that,
Right.
what is your response? Because
It's an easy response. I mean, it's that they have the land, they don't have the rooms, they don't have the
let's let
capability.
Mary respond.
Okay.
Let's.
Yeah, definitely they don't have the room. I mean, this is the reason why we have 13 hotels contracted with the military. And also it doesn't make sense. They don't deal with this on a regular basis. This is an anomaly. This is a special emergent situation. We would never expect to have to house 3,500 military. If we did, they would build enough hotels inside the fence to handle 3,500 military. The mission in this PAC fleet area from Guam all the way to Korea to Singapore and every other place within the geopolitical area that they have military personnel is not to keep them there for long periods. A lot of them are there for short-term stays with TDY of 2 to 6 months. Rotations are no longer going to be your 3 years unless you have a family. The unaccompanied tours are going to increase in this region. Already, my husband was in Korea and in charge of that military project for 4 years. They have moved from long-term stays to 9-month rotations unaccompanied. So this is going to be the future, I think, with Guam, in that they will not need long-term lodging for like houses and rentals for a lot of the military in the near future. It's going to be hotel rooms because they're only going to be staying here for 2 months up to 6 months at a time. And so this is going to become a bigger part of our business in the future, especially as it's going to be harder for our tourism arrivals to return. And so we need to be comfortable with this regardless. The military are not going to build hotels inside the fence. That is not their core business. Their core business is defense. And so they only have Navy Gateway Inns and Anderson Lodging. Now, in this kind of a surge, in an emergent situation, of course, they have the Red Horse team, they have the CBs, they have all those groups that go out and they build whole camps in days. Yes, I understand. And that's in war zones. And they could have done that here probably, but timing is of the essence, and they can't go and build camps because you have the USS Roosevelt here, you have the USS Reagan in Okinawa. We need to meet the need for those, and the mission is to get them off the ship, decontaminate it, and get them back on the water.
Right. No, I completely understand.
If we can meet the need locally through private sector and mitigate all of the risks and reduce the risk down to almost zero, then why not? I think that the business case is there for everybody. The business case is not there to build anything inside the fence.
I hear you.
I hear you, Mary. I mean, yeah, just
But
that idea that
comfortable. But I really want to stress the importance that this is an emergency thing.
Yeah.
But in any given day, we may have 3,000 personnel outside the fence anyway. We definitely have more than 3,000 personnel outside the fence. And so we have to be comfortable with the fact that part of our book of business is leisure travel. The other part of our book of business is Department of Defense, whether it's federal contractors, military, TDY, long-term stay military. We have a lot of people with Department of Defense funding, even local government defense funding, whether it's federal funding like with FEMA or any other type of government business, local or federal. That is our large book of business for a lot of our hotels, and not just hotels, transportation, restaurants, meeting rooms. We've had build-up meetings and conferences over the years, and it is unsettling to me that we still don't get how big the military has played since World War II, well, probably even before World War II, but really as far as lodging and services, the fact that we've had build-up conferences since 2007, and we still can't understand the importance of the military to our region. And if you look at I know that there's concerns about us being part of the federal government. If you look at all the federal grants that are going to be coming our way and stimulus package, we would not have that available to us if we weren't a U.S. territory. It would be on our own. And so there's a lot of things that people have to understand when it comes to when you accept being part of the U.S. government, you accept a lot of other things as well, benefits, but also challenges in what people consider challenges. But these are also opportunities, and this is the way we conduct business, especially the importance of our island in this region to the U.S. PAC fleet out of Hawaii. Guam is pivotal. It's a significant place in the middle of the Pacific Ocean. And so we have to understand the importance of this business and really understand the need in how we both and the role we play in this community.
all right.
And I think that if you don't understand it from a business perspective, maybe from a humanitarian perspective, these are people, that have tested negative, that are going out into these hotels. They are human beings.
Yeah.
Before anything else.
I don't think that people have to feel comfortable with it. I think people are going to feel the way they're going to feel. I mean, yourself, Mary, you're saying that even with all these measures that exceed what we ask for, there's still a risk. And this is a crazy time. It's unprecedented, right?
We're human, and by nature, we're going to be concerned about it.
Of course. So I don't think we should be telling people they have to be comfortable with it, because they don't. I mean, people can feel the way they feel.
No, what I was saying is we have to be comfortable with the fact that military is part of our environment. That is what I'm saying. I agree. I said it myself. Everybody is concerned, and for good reason. I would like to see more of our businesses escalate where we cease operations, like general construction and commercial construction right now.
Wow.
I would like to cease operations right now as we see a surge in the community outbreak. I would like to see a lot more being done, and I've been asking that of the front office, is when are we going to escalate so we can limit movement.
Well, what are you hearing, Maria? What are you hearing about the escalation of the order? Because we're hearing some whispers about that the order is going to be extended and that it is going to be strengthened. Have you guys been a part of that conversation?
I think that there are always discussions, and they always have plans. I think that after today's news conference, I'm sure that there will be plans to extend and to escalate at some point. But I think that we are at that point, and I think we do need to escalate certain types of businesses where we can control movement a little bit more. I think that, obviously we need the groceries going, and fuel and food and essentials and shipping and all of that. But some things right now I think could stop, and I don't think that the businesses should wait for the governor to make those calls. I think that we should do all of our parts. Yeah. And if it makes sense to just close shop, then just do it.
And we have
It's the right thing
seen
to
that.
do.
I mean, early on, Mary, there were small businesses that put out messages that, hey, because of the risk to our employees, we're going to close. So
GHRA closed its office from day one in advance of the closure, but we're still working from home. And, it's just everybody has to do their part. We can't wait for the governor to tell us also what to do, although she is doing her part. We also have to assist her, and that is what she keeps saying. But I think that a lot of people are still trying to figure out how to survive. So it's a very complicated time.
oh
and
man, that's an
unprecedented.
understatement.
So
And we're just getting started,
everybody-
Mary. There's a
I know, we're
presentation.
just getting started. That is what I'm saying. I think that we've done everything we can to help mitigate risk for community exposure. We are at that point where community exposure is already there. So we need to escalate, but everybody needs to do more than what the governor is asking at this point, because she's limited in what she can ask within her powers. And she's trying to balance healthcare together with business, with the economy, with so many things. But we as individuals, as business owners, or as entities, or as human beings and citizens of this island and the U.S., we need to do our part and really stay at home.
Yeah.
And to avoid putting other people in contact. If you have somebody at home, it's all the same messages, but people aren't acting on it. They're not really taking heed to it. And I hope after today's press conference that people really listen and start really taking action if they haven't already. It needs a community-wide effort.
Thank you, Mary.
Thank you.
All right.
Any final comments? Because
Oh. Don't give us no more
just-
Debbie Downer for now. We got a lot
No
of.
more Debbie Downer. I think that Guam. I think that there are of course always concerns and there's always risk. I hope that everybody can be reassured that Guam Hotel Restaurant Association has been working with both our federal partners and our local government to ensure we mitigate all risks and we reduce or almost get it down to zero exposure with our hotel staff, and we really provide the necessary the need that is being called upon today, and we are creating a model that we can follow going forward if this surge does happen. But we need the support of every agency. There's a lot that needs to be worked on if we are going to operate in this way. And so that's why we're really treating this as an opportunity for all public sectors and private sector to work together so we can come out of this 14-day period and say we planned, we executed, and we got the results we wanted.
Thank you very
thanks,
much,
Mary.
Thank you.
Appreciate everything you're doing.
Yeah,
Thank you.
Thank you for your time, and keep us posted.
Yes,
Okay.
definitely. Thank
Goodbye.
you.
There you go, Mary Rhodes of the Guam Hotel Restaurant Association. 821. A lot of information there. A lot of information about the quarantine of the sailors, and we're
Looking
gonna
at 8 hotels.
right.
And this quarantine is only for sailors that have tested negative.